Wow, what a political week we have had. So I think you know this is MTP number 43. It's been kind of crazy. We have a great question, actually, from Ken. I won't say his last name. And he says he's has AFib and he's taking Xarelto, okay? And he's wondering if he's a candidate for a penile implant. So let me explain. A lot of people are on anticoagulants for the most part because they have something called atrial fibrillation. Some are on anticoagulants because they've had stents put in place. There's different classes of anticoagulants. I can tell you that here at Perito Urology, Dr. Sarmiento looked at the patients that use antiplatelet medications. And he looked at our morbidity associated with them when we were doing a penile implant. And guess what? It was identical to people that were not on anticoagulants. Now, let me make this real clear. These were patients that were on antiplatelet medications. It would be Plavix, Xarelto, Eliquis. It's a certain class of drugs. And the reason this class is important is because a lot of you guys have stents in place. And you've been told you can't have elective surgery where they pull that anticoagulant off for 2 years, 1 to 2 years, depending upon which papers you read. Here, we are able to operate on you on those drugs safely. Now, when you're looking at other anticoagulants like Coumadin, and there's a whole other group that are not antiplatelet medications, we would dissuade you from doing that. Regardless, if you have a cardiac issue, you should get cardiac clearance because you're undergoing an operation that's something that's completely elective, although for some of us it's far more than it's emergent. So to conclude, first thing you do is you go to your cardiologist and you get your clearance to make sure that you're okay to have the surgery. Second thing, you can inform your cardiologist that antiplatelet medications, and they'll understand what we're talking about, can be maintained throughout the procedure, and you don't have to pull that from your drug regimen. So this allows an enormous group of men, especially the guys who have had stents, to get their penile implants sooner rather than later. So great question. That was Ken. You guys have a great week, and I hope it's not as tumultuous as it was last week. See ya. Bye.